So today I'd really love to, just touch on, how being an advocate for health literacy can really change someone's practice. And I would really love just to touch on what made you truly passionate about this before we get too far in it, because I always like to know the why.
Yeah. Yeah, I think that the constant of regardless of what practice I worked in or what I was doing, the one thing that I consistently loved was educating the patients,
Hmm.
seeing where their brain would just kind of click where they got it. Or, them saying, "Oh my gosh, nobody's ever explained that to me before. I've had this my whole life and no one has taught me that." Those types of things were really the main positive thing about optometry that I loved. And I think that in optometry school, there's not a lot of education on patient education. We're
Right.
taught how to talk to them in the chair. We're taught how to, simplify medical jargon and do teach back and things like that. But there's nothing beyond the chair. They don't teach us about how to connect with our patients and communicate with them once they leave our chair. So for me, that was just a huge thing because, like you said, I feel like it's something that's not overlooked, but maybe not prioritized in the way that it needs to be.
And that's the key. I mean, at the end of the day, communication is king. And with that being said, you mentioned the chair, right? The exam lane, that time we spend with that patient while they're sitting in front of us. In this article, you really touched on choosing your words wisely. Would love for you to kind of expand on that because I find that in order to really connect with patients, you got to understand that person that's sitting in front of you and speak the same language that they speak. So if you don't mind
Right.
constructing that a little bit more and giving some tips to the folks out there that are listening.
Yeah, I mean, I think that a lot of doctors understand that we need to simplify terms as much as possible, but I think that sometimes we need a reminder that simple terms to us is still not a simple term to the general public.
Mm,
We in my clinic, we do a lot of myopia management, and so we can talk to patients about myopia control, but sometimes you got to realize that they don't know what myopia means. And so a lot of times we break it down to say nearsighted, and
right,
then maybe we need to realize that people still don't know what nearsighted means. So a
right.
lot of times I try and take things all the way down to the foundation and work our way up. I've definitely learned through practice that you can't take patients' nods of understanding and, to mean that they're getting it. So I really like to start at a base and start with, here's what nearsighted is, here's what it means, here's why we want to control it. And the bigger thing for me too is also making sure that we educate patients about what's normal. I have a lot of patients where
Okay.
before I've shown them optomap images and they've never seen them before, even though they've had them taken. So I think that it's important to educate patients about normal things, show them their normal optomap findings so that down the road, if they have something abnormal that pops up, you're not having to start the conversation from the baseline of saying, here's a retina, here's a picture of it. They've already seen that year after year. They know what normal is, they know what we're looking for. And now it's easier to have that conversation about something that's abnormal because we've taken the time to educate them about what is standard.
And when we look at this concept, I think we can look at it in a multi-layered approach, right? I mean, it's one thing to have that conversation with our patients, but I think also we have to have that same conversation with our team members, right?
Hmm.
I feel like we all should be on the same page when we're communicating in that office. What you say, your team members in the office should be aligned and be saying the same exact thing and understand it. And in order to make that happen, you have to choose your words wisely when you're having that conversation with your team members as well, because they're a
Yeah.
reflection of you. They're an extension of you, and you're not always going to be there to answer a question.
Well, and a lot of times the team members too will be the people that kind of make me realize when I need to break things down a little bit more. So to have team members that feel comfortable enough with you to say, "Hey, what is this test? Why are we doing it? What does it mean? What are we looking for?" And then if I explain it to them and they're like, "Okay, what does that mean?"
Yeah,
Those types of conversations just really help you understand, okay, this is someone who works in the optometry field. They're here every day and they still
yeah.
may not know what this term means. So I really need to take a step back and how I explain it to patients.
That's huge, Caitlin, because it's that bi-directional approach, right? As doctors, we always think we have all the answers. And sometimes we don't even have the answers, right? But if you have a team member that's coming in and they're telling you to say something in a different way or asking you how to explain something, it's up to us to figure it out to make sure they understand and again that the patient understands. So it's bi-directional. We teach our team members, but they also teach us things. And at the end of the day, it's going to make it so that the entire office is performing at a high level.
Absolutely.
Now, in this article, you also broke down that we should use our time wisely, right? Although we probably do spend more chair time than any other healthcare disciplinary out there, I would love for you to kind of touch on that a little bit more. How can we use our time wisely?
Yeah, I mean, I think in optometry or really any medical practice, there's so much focus on our time constraints, schedule constraints, and yeah, chair time of how we're able to how much time we're able to communicate with that patient while they're there. So for me, yes, talking to them is important, of course, um, but only 30% of people are auditory learners. So
Hmm.
to understand that the majority of our patients, you can sit there and talk to them all day with as much time as you have, but they
Sure.
still may not get it. And that really hits home with me because I am not an auditory learner at all. You can ask anyone I went to optometry school with. I type like 160 words per minute because
Woo!
I have to. Because I have to get down like yes. I
You were
have to
smoking
get
over
down
there.
every word.
Hey, you
I
know
will just
what?
type a lecture out word for word.
We would have been best friends at optometry school because I would have been like, she got all the notes. I'm hanging out with her.
Probably how I made a lot of my friends. But yeah, I need that. Like I need to be able to write it, read it, process it in my own time.
Yeah.
So I think that there's just not a lot of emphasis put on the fact that a lot of us are visual learners. We want to
Yes.
read, we want to see videos, we want to see visuals. So you can talk to me in a chair all day long, but I'm still going to leave and go, wait, what did he say? What was I?
Right.
And if I'm doing that as a doctor, I know that regular population is going to be doing that as well.
What's up, esteemed colleagues? If you like this short highlight, there's more where that came from. Dive into the full episode right here. And if you haven't already, hit that subscribe button and ring that bell for our latest updates. Make it happen, Captain. We definitely want you to tune in. Your support fuels our passion. See you in the next highlight.